really excited to welcome our first guest of the evening, Stephanie, a director of palliative care down at Texas Oncology. How are you doing today, Stephanie?
I'm doing well. Thank you so much for having me.
Absolutely. Thanks for joining. I've been really excited about tonight. You were introduced to me by Josie, who happens to be my oncologist nurse from when I went through breast cancer back in 2011. And she's on our board now. And she's been talking about you from some time. And, you know, you kind of came up as a result of this experience that I had with my friend Amy, who just recently passed away from stage 4 metastatic negative breast cancer. And so I just feel so important to talk about this topic. And I know it's a really heavy topic, and a lot of people are going to have a lot of questions. But I thought what we could start with, Stephanie, if you don't mind, what is palliative care? Can you explain that to everyone?
Well, sure. I think a lot of times people hear the word palliative care and there's an emotional response automatically because oftentimes when it's introduced, it's at end of life. But really, palliative care is an approach to care. So I want you guys to think about it as a method of care. And so palliative care is like where we say we want to take care of the whole patient. So it's about palliating symptoms. So it is where we want to serve and provide care to our minds, our bodies, our physical well-being, our emotional well-being, and our spiritual well-being as well. So like holistic treatment of the total pain. And so palliative care is not just a philosophy of care, but it can also be a service or a level of care. And so we think about our palliative care. We can have community-based palliative care, or we can have inpatient palliative care or clinic-based, or home-based palliative care. But really, it's a service that provides an interdisciplinary team approach to addressing the symptoms and the needs of patients. And so when we think about hospice, hospice is a type of palliative care, whereas you can have palliative care without hospice, but you can't have hospice without palliative care. So hopefully that's clear, but it's really about the overall treatment and how we address the needs of patients. So palliative care basically says, I understand this is the primary diagnosis or issue. Palliative care is going to focus on how it makes you feel and all those other areas.
Oh, that's a really, really great description, Stephanie. The part where you said that hospice is like a type of palliative care. So it's like palliative care is above everything, and then you've got all these elements that can fall below it. And it's interesting because there's so many different areas that it sounds like it covers. It's not just hospice. It's probably like caregiving. You said spiritual. So
Yeah.
in that sense, like for example, say that you've got somebody that's come to you and their care team has come to you as well. So you've got someone who's terminal, and their family or friends coming to you, and they are looking for spiritual assistance. Like maybe they want to get more involved in a church. Do you actually help them, connect with different organizations, or how does that play in?
We can. It depends on the approach and the type of program and what services are available. And so, in a lot of our areas, there are chaplains that can be utilized. Texas Oncology doesn't have a palliative care team at Baylor Sammons, but what we do use is partner with the Baylor Palliative Care Team, which is an inpatient team. And so, utilizing chaplains or community palliative care teams that provide services as well. Or like myself, sometimes there are members of the interdisciplinary team that may provide services. So, for example, if I were to personally see a patient and they're having some spiritual distress, part of what I would do is we call a hope assessment to help gauge what their areas of distress are, and then try to make sure I'm helping them connect the dots. So I'm not a chaplain, so that's not my strength, and that's not my scope. But what I am going to do is address that they have that need and try to help them figure out how to best address it. So that may mean connecting them with a local chaplain. That may mean seeking out what are your previous faith-based or spiritual needs or connections, and then also exploring, if they haven't done that before, they want to explore connecting them to maybe a clinician that could help process those spiritual needs as well and explore what those look like, and then finding a community partner to address that. One of the things that's really important is that in palliative care, we may not always be the person to address a need, but we want to make sure that we're evaluating and finding the person that can address it.
Yeah. So
And I also
you're.
wanted to, I'm
Oh, go
sorry, go
ahead.
ahead.
Go ahead, Stephanie.
I also want to say, you said one thing about palliative care being an end of life. I really wanted to make sure that I was clear that palliative care is appropriate for any patient at any stage of a serious illness. One of the things that we know to be true is that if patients have access to palliative care sooner, we see an improvement of quality of life, not only for the patient, but also the caregiver. So we really want to make sure that patients have access to palliative care, because what we look at is how do we make sure that we're addressing all of these symptom needs while you're receiving treatment.
Brilliant. It really is. And like I said, Stephanie, having gone through something like this with your friend recently, all this, really makes a lot of sense to me. And it might not make as much sense to other folks. What is like one of the biggest challenges that you're seeing, like patients and caregivers having?
I think, honestly, if I think about facing a serious illness, number one, there's the grief. I think even if we are doing well and we have great outcomes, there is a magnitude of grief that comes when we're dealing with a serious illness because it takes something from us. And so it's about adjusting to what I hate the word new normal, but it really is helping people find the new spaces. And so cancer just doesn't happen to the patient; it happens to the family, it happens to the caregiver, it happens to the friend unit, the circle. And so we want to make sure that we are addressing those things. And so I think the biggest thing that I see is just the adjustment. Cancer impacts your life in a lot of aspects, and so people struggle with finding that space and processing. But I think when we look at people who are, have a poor prognosis, one of the most difficult things is just exploring mortality. We live in a society that doesn't talk about death. So we fear the conversations, we fear the need to navigate it, and we fear, putting things in order because of what it can mean. And palliative care really says that really how we're empowered and navigate best with our care is by having these tough conversations as early as possible. So we know how to best serve you. So your care team knows how to best serve you, but also the people around you know how to best serve you, which I think you've shared by you guys' experience that having some of these conversations so early help to make sure not only did does your family experience change, but also that what they're left with is a different dynamic as well.
So, right. And I'm just gonna be straight up honest, like the thought of like preparing for my own death is something that I don't want to mess with. It's like, I'm always like, oh, I need to make my will, I need to do this and the other thing. And honestly, I'm just gonna be straight. Like, I'm just like, well, what do I care? I'll be gone. But after seeing what Amy went through and how much preparation she put into that transition of her life to another world, so be it, it was so beautiful. She did it so gracefully, and she had so much control over what was happening. And I think that's important for people to realize is that she made her own death so much easier on herself and all of us around her too.
And you said it, it's about control. One of the unfortunate things is that we don't get to always control the disease. Like we can't, control where it escalates or where it grows and the systems that it impacts. But if we do proper advanced care planning and completing our advanced directives and having these difficult conversations with the people that we love, we control the narrative about our lives and up till the end. I personally believe that death is a part of living. So that is part of controlling my life and setting that tone. Some people don't get that luxury, but when we're fighting a serious illness, we get to say, and we do this planning as hard as it is, we get to say what I want this to look like. And then doing these conversations and having these things documented is an act of love. One of the things I always share is that families and caregivers will always be left with grief. Grief is the price that we pay for love. So we can't rid them of their grief. Their task will then be learning to live with that grief because that'll be with them forever. But what we can help is make sure that they don't live with guilt. And when we don't properly equip patients with the time and space to navigate and make sure that they can prepare and have conversations and document those wishes, then we run the risk of their family members being left with guilt about, did I do the right thing? Should I have done more? What if this would have been this? What if they wanted this? But when we document and can have those conversations, then that guilt isn't there. The grief is always going to be there, but the guilt isn't.
You are so spot on. I'm not kidding. Like everything that you're saying is everything that Amy gave to us. She was so prepared that it's so easy to just be like, oh well, this is what she wanted. We're gonna do that. And regardless of what it is, we never had any question about what she wanted. She had everything laid out, whether it was even just within her care. She made us a checklist. These are the things I need done. And we were like happy to just go and do that. Every day we would go over there and we would go through her checklist of stuff that she needed done. And it might sound monotonous, but those were things that she wasn't able to control herself anymore. And so we were able to control it for her. And that gave her a lot of peace of mind, I feel. Knowing that
Yeah,
those simple tasks around the house were being cared for exactly how she wanted, and it
yeah.
was stuff like that that was so very helpful. And I think it's so important for people to hear this that, this kind of planning and this kind of forethought thought is so important, not just to yourself, but to your family and to your friends around you, and making sure that you're wishes are cared for. And like I said, Shayna is still doing that to this day, making sure all of her wishes are carried out just like she wanted. And it's easy because she drew us a map, you know?
Yeah, yeah. And I think that's part of what it looks like when I'm sitting in spaces with patients. You know, of course, I'm a social worker by profession, so I'm an LCSW. And so I'm a therapist, but where I specialize is helping individuals who are living with a serious illness as part of our interdisciplinary team cope and deal with and process what their wishes are, what their goals are, explore their mortality, explore what's important to them. And so when I'm sitting with patients and we're trying to wrap our minds around what this looks like, it's a really difficult process sometimes, but the reward is that they're able to find this place and empower about how do I share these things with my family? And sometimes people don't know. So having the opportunity to sit with a member of the palliative care team, whether it's the APP or whether it's me as the therapist, or whether it's the physician or the nurse or the chaplain, to really help them process and figure out what's important. But what we take pride in is saying that it's your life by your terms. And so we help create those tools and help navigate to say, you get to define this. I know everything else is felt out of your control, but here's a space where we want you to feel like you have some control. So that goes to symptoms about what things you're willing to deal with and what things you're not. It goes to about what sounds you want to hear and what you want your space to look like and who you want around you and what kind of level of care you're willing to receive and where do you want to receive that care. All of those things are things that we want to explore because they're important.
So true. The thing that's cool about what you do is it kind of feels like a one-stop shop for these type of illness these patients have these type of illnesses in their family. And that's so important to have the access to counseling, access to a chaplain, maybe end of life planning, different, grief counseling, all the different things that you've mentioned. I think it makes such a huge difference, you know. And like I said before, having the fact that Amy had done all of those things in advance really made it better for her caregiving team, and also it made it an honor to be a part of that, and you were proud to have that opportunity to care for her in the way that she wanted to be cared for.
That's so great. Y'all, I think I shared with you before. I think one of the things that's really unique about, and I hope this doesn't share too much, but one of the things I think that's really special about what you guys were able to do is that some caregivers are thrust into caregiving, where, there really isn't a choice. There's somebody that has to pick up the mantle, there's care that has to be provided. And so some people just have to figure out how to navigate it. But when people don't have large family units and there are people who choose to step into that space and choose to be caregivers, or even family caregivers who choose to make those choices to show up dynamically in those spaces, it's such a gift. And so I hope you guys in your grief and as you look back and explore the life that you shared, that you guys also see what an asset you guys were for her. Um, because it makes all the difference when you have people supporting you and you can trust your legacy in their hands.
Well, thank you for that. I again, I think that we felt truly honored to be a part of it. It's kind of an interesting thing as a caregiver. Um, it's it's the hardest thing you could ever do, but it's also the biggest blessing, to be able to be a part of someone's, last days on earth, and to do everything that you can to make it the best possible and know that you did everything that you could to make it the best possible. When you meet Shayna later, when you hear her on the broadcast here, you'll see what a wonderful job she's done leading that charge, and those people are true angels, that pick up that mantle and run with it like that. I mean, it's been very amazing. Stephanie, I'm curious, what was it that, brought you to this in your career? Like, how did you end up in this position? I mean, you seem like this is just a perfect fit for you.
Well, thank you for saying that. I'm honored. So it's really funny. I didn't. It's going to be a long answer, so I apologize in advance. So I had a significant loss as a young adult, maybe probably teenager, probably is fair, but young adult, early college student. And during that time, a hospice came to provide care, and within the context of that loss, I've always been inquisitive. So they let me read things and they gave me these books and they answered my questions and they let me help. And I was able to, be a little caregiver. And it laid an impression on me that I wasn't aware of until later. And then also I'm the granddaughter of a Baptist preacher. And so those dynamics also include my grandfather and grandmother spending so much time caring for those in their community that were sick. We visited the sick all the time, and I kind of was always often with them if I wasn't, busy doing something. And so those things laid impressions on me that I didn't know would manifest later. So as I was working in my career at a care management company, really a physician's IPA, where we were delegated to manage the care of complex patients, we were trying to figure out how to best serve these patients who were always sick, always sick. And so one of the things that I realized is that oftentimes they were ending up in the hospital because they really had no other place to go. But then really it was because they were declining and nobody knew what to do and people weren't having conversations with them. So I started to kind of be like the hospice whisperer, and I hate to say it that way, but kind of like the person that could reach people who were trying to make a decision or no one had to try to have this conversation before, and would be able to successfully get them to an appropriate level of care where they were comfortable and could get their needs met. And so then we started this pilot program with Respecting Choices, which is an advanced care planning approach. And it was really successful. And so we did this training and I was sitting in it, and it's just a regular training, how you go for CEUs, and I was weeping, like I was immediately overcome. And I was like, this is what I want to do for the rest of my life. I had done PRN hospice since I've gotten out of grad school. But it was, I knew it was something I enjoyed, but I didn't know this piece was there. Because of course, hospice social work does look a little bit different than palliative care social work. And so in that meeting, I was like, I think this is what I want to do for the rest of my life. And so I started kind of taking trainings and even shaping my career and what I was doing at my current role to that. Long story short, I ended up developing some programs to help, model this. And then I went to a company that allowed me to develop a program where we just had these conversations all day. We found patients who were high risk, and we had these conversations and were able to help them figure out what they wanted for themselves and their care for their family. And then that job that I left reached out and was like, hey, one of the things we thought about is that palliative care is something we do really want to do. We do know this is what we want to do as part of our extensive care clinic. And Dr. Brown and Dr. Finley were like, we want to do this. And so I came back and we built a clinic-based palliative care program that became an outpatient palliative care program that I was really proud of. And then I transitioned to Texas oncology years later. And so it is shaping me. I sit with patients, and I'm also in private practice. And so I sit and share space with patients who are really exploring their mortality. And I take such honor and pride in being able to share that space because I know it's difficult. And a lot of times there are patients whose lives end and they've never explored or shared what their deepest thoughts are or their fears or worries. And I just want to make sure that people, and I hate to say die well, but I really mean that, like that everyone has a right and opportunity to die well. And I struggle with that terms. If you haven't noticed, I struggle
Oh,
with terms sometimes,
I
but
love that
um,
though. I really
but
do. I think that's awesome. I'm sorry to interrupt you, but I just wanted to say, like, I'm sorry I keep bringing back, but this is my first experience with this was with Amy, and so I'm gonna continue to bring that back up. But um, this sounds crazy, but I feel like she died exactly how she wanted to, and how many people can say that? You know,
not a lot,
not a
not a
lot.
lot.
She was
No.
prepared. She knew exactly how she wanted to die. She knew she wanted there. She knew where she wanted to be. She knew down to, you know, intimate things that I'll probably talk about with Shayna here in a minute. Exactly how
Yeah,
she wanted it to all play out, what she did want, what she didn't want. And she died on her terms. And I mean,
yeah,
you just can't realize, it's hard to realize that you have that ability and that you do have
hmm
a space that you can control. That's the most important thing that I'm hearing from you, is that you feel in this uncontrollable area. You're like in this uncontrollable situation, and then you're helping point people to the areas that they can control. And that's so
yeah,
important when you feel like you're out of control, to have control of something, you know?
yeah. And I think too, like people, like when we talk about hospice and we talk about palliative care, oftentimes people are like, well, if you talk about that too soon, patients will lose hope. And I really struggle with that notion and completely disagree because I believe that there is a way to have hope in a hopeless situation. In what feels like or seems like a hopeless situation, oftentimes death is that, right? We think that we've lost hope, there are no other options for treatment. But when I think about the fight, I'm not ever that person who tells a fighter, so we're going to stop fighting. Let's go on hospice. That's not the approach. For me, for the fighter, one of the things I firmly believe is that even if a person passes away, they still get victory over cancer. And so I don't see switching opponents as quitting the fight. What I see once we've done everything that we can do to treat a patient is that now we just switch our opponent. Rather than fight cancer, we're fighting for quality of life. We're fighting for to ensure that each day is memorable. We're fighting for legacy preservation. We're fighting for joy. We're fighting for those things. We've just switched our opponent. And I think that's how we have to frame this to make sure that when people are having these conversations, that we don't, strip them of their joy. Because I tell my patients all the time, we can have this conversation, and I hope we never have to use the things that we discuss. But because your life is so valuable to me, I want to make sure that if we get into a space that we need it, I know exactly what you want us to do. Your family and your care team knows exactly how to care for you because your life matters until the very last moment you take your last breath. And so I want to make sure that that's the message that's conveyed, because sometimes people are even resistant when their physicians, talk about advanced care planning really early. If I had my way, the moment you were diagnosed, we talked about advanced care planning. But that's because I think, how do I know what's important to you regarding your goals if I don't ask you first before I treat you what your goal is? And so I think we have to change about how we um, navigate these spaces to make sure that we keep the goal in mind. And of course, the goal is beating cancer and living a long, healthy life. But what if we don't get that answer? How do we make sure we're still prepared?
Love the whole concept of we just have a new opponent. That's awesome. I mean, it's so true, and it's not an accident that we're meeting today and that everything came together like it did because everything you're saying really speaks to me, and it's part of a story that I think needs to be shared. Um, you know, the services that you guys offer, the type of work that you do, and the success of that type of care for Amy, you know, that was a success, the type of her planning and everything that she did, it was successful. She may have passed away, but she did it on her terms and she had everything done exactly how she wanted and that's possible for anyone. And like as we're sitting here talking, I'm like making a note, make plans for myself, because I'm like, why
Yeah.
wait? It'd be so good to have all this figured out right now. It's scary to think about, but when you put it like that, you're putting yourself in control of your future, um, where there's no questions asked. Everybody knows here's what you do. It's so much better. It's so much better, and it's always
Yeah.
been a very very scary thing for me, and I'm sure many people, and obviously people that you meet with on the regular. But I think it's so important that people do that because it really, really does make a difference. I'm sure that
Hmm.
you have plenty of stories that you can share where somebody maybe didn't do the preparation in advance and it really went down in a bad way and it was maybe
Yeah.
not what they wanted and everything was chaotic and whatnot. And then you have the other stories where people had the time or the forethought to do preparation in advance and it just it's hard to say that preparing for your own death could somehow make it smoother, but it really is possible, you know?
It is. And I think when we think about death, especially I believe every human over the age of 18 should do at some level of advanced care planning. So whether it's just your medical power of attorney and your living will, like just do that, right? With your living will, and I mean your directive to physicians, we use the name simultaneously. But I think every human should do that over the age of 18. But I think if we're dealing with a serious illness or we've had experience with a serious illness, it's important to take it a step further. For me, one of the things that gets on my family's last nerve is that I often bring this up when we're all together. I will, bring up these kind of conversations. And not that I'm trying to dampen the mood, but I need you to know what's important. I need to know what's important to you, but I also need you to know what's important to me. And so we have those kind of conversations, and it often can make people feel uncomfortable. But even for my own family, I saw how it served us as my grandmother declined. And we made decisions about her end of life care because we were prepared. We had had the conversation. It hurt like heck. It was hard. It was difficult, but we knew. and we knew how to best honor and serve her because of what she's expressed to us. And so I have examples also in my own life where it didn't go well. So I think, I just really think it's important that we emphasize not only just about palliative care, but the idea that like being empowered in your healthcare looks like having the tough conversations, and then having support to navigate those when necessary.
Yep, and, I'm really, really fortunate that my parents are 80, and they've been preparing and doing all this stuff for years and years. I mean, down to, like, they've got all their will, all their power of attorney, all that stuff set aside and figured out, and then they have, like, books of, all their medical history, where they have all their medications, they have all that kinda stuff. They've started saying, "Okay, here's some stuff that, we want to, pass down. Y'all start get what you want." Like, I mean, they're 80, so they're like really ahead of they're really,
Yeah.
ramping up and everything. And that matters because it will make it so much easier for us kids to know exactly what it is they want. I mean, my mom, I think she has her whole entire funeral planned out. She probably knows who she wants to speak at it and everything. Like she has her plot picked out and I mean everything's done and probably phone numbers to call the whole nine, and it is so so important. So Stephanie, if somebody is interested in learning more about palliative care, where would you recommend? Is there a website?
So there are some great websites, of course. We have some resources available, of course, at Texas Oncology. You could Google Texas Oncology, and we have some palliative care resources. You can look there. But there are also national organizations that provide great resources on palliative care. So NAHPC is the National Hospice and Palliative Care Association, and they're great tools about thinking about things. But one of the tools I will encourage everyone to go and take a look at is conversationready.com. I always get it wrong. It's either conversationready or conversation.com or .gov. It's not gov, it's .com. But it is the conversation project has tools that you can sit down with your family and ask. And if you're the caregiver, it has tools to prepare you to ask your loved one those questions. Or if you're the individual making the decisions, it has tools to help you explore what those things mean to you. We also have some tools as well on our website to kind of help navigate those things for patients and explore important decision making. One of the tools on the conversation project, I feel like best meets the need of like an individual who's healthy and maybe doesn't have a specific illness that they know will impact them, but wants to make sure that we discuss some of those things. And then they have tools that are for individuals with dementia as well. And so I think it's a great digestible tool for any individual at any stage.
That is so awesome. That's amazing. I'll be sure and add all those resources to the description when we pop this out on our YouTube channel. We'll be popping this out there in a couple of weeks. So this will be a replay available on YouTube. And also, this replay will be available on Facebook just as soon as the broadcast is over tonight. Stephanie, thank you so much for joining this evening. You've been so amazing and it's very enlightening. I love your perspective, and I think it is such an important piece of information that people really need to know about and take action on too, not just for themselves, but for their loved ones as well.
Well, thank you so much for having me. It's been an honor, and I'm just so grateful that you guys are sharing the message of palliative care, because I firmly believe that every patient deserves access. And hopefully, I'll complete my mission by spreading the gospel and helping to, palliative care and helping to increase access for everyone.
Oh, it's so good. And we got to keep in touch on all that stuff. I know we're going to get a lot of resources from you that we will add links to from our website. So we'll be
Yes,
sure and do that. So I'm going to keep in touch with you because this is a really important one for me, Stephanie, and for all of our viewers out there. I want to make sure we get the word out.
please do. And I'll make sure to get you some good resources to be able to share. Thank you so much.
Awesome. You have a blessed night, Stephanie. Thanks again.
Bye bye.
All right, everybody, give it up for Stephanie. She was a rock star. So excited to have her on the show this evening. Stephanie, Director of Palliative Care over at Texas Oncology. We will be posting those resources soon so that you guys will have easy access to that. Such a great conversation to have. Again, guys, if you haven't shared the broadcast, be sure and share that out. If you joined late, be sure to watch the replay. We've got our next guest coming up here in about 15 minutes. We're going to have Shayna. She was one of the awesome caregivers, the main caregiver of my friend Amy Boyd, who passed away a couple of weeks ago. We have a lot of things that we want to talk to you about how Amy was so graceful in dealing with her stage 4 triple negative metastatic breast cancer. Just so much to learn from her, guys. I know it maybe it sounds weird, but I feel so blessed to have been a part of her life at this very important juncture, where she transitioned off to another land where I picture her playing roller derby every day and swimming with sharks and God knows what else. But anyway, I can't wait to talk to you guys more about this. And again, if you have questions throughout the broadcast, be sure and pop them in. I'm always looking to see if there are any questions or comments, and I'll be sure and pipe in and read those along the way. I want to give a shout out to Vicky, Chuck, Grace, and Bill, Angie, Iris. I got a lot of great comments in here. Shayna says, great job, Stephanie. Jana is coming up next. And Josie, a big shout out to Josie. She is on our board of directors and she hooked us up with Stephanie tonight. So thankful to have her. I really think that this is an important message, guys. So please, please, please broadcast this out, share it out. And let's all think about planning our living wills, our, all the different things, the power of attorney, all those things that we need to do to plan. It really does make a difference, not just in the lives of your family and friends, but in your own life too. So I'm making it a point this year to take care of those things myself. I've always been afraid to do it, but after seeing what Amy did and how prepared she was and what a difference it made in her life and those lives around her, it's really, really, really worth the effort.